name is Allison Kane. I am a speech-language pathologist. Most people know of a speech-language pathologist or an SLP as a speech therapist. It's the same thing. We provide speech therapy. A speech therapist provides evaluations, treatment, prevention for any disorder related to speech, language, swallowing, cognition, voice, resonance. We cover a lot of areas. Most people think that we just work on S sounds or R, but we do cover a wide scope of areas. We treat a wide variety of diagnoses. Speech therapists work with adults and children. Typically with adults, we're seeing aphasia, people that have come in with dysarthria or following a stroke. For pediatrics, we treat a lot of developmental disorders or neurological disorders that may involve autism, just typical language delays, Down syndrome, any sort of global delay. We treat a wide variety of delays. As a physician's assistant, you would be looking to make a referral for speech therapy for a wide variety of areas. So a speech-language pathologist works on articulation. This is how we coordinate movements for speech sounds. We treat language disorders. This involves receptive and expressive communication. So following directions, understanding questions, being able to answer questions. Social communication. Can they use gestures? Are they withdrawing in different situations? Are they participating in whole group activities? Pragmatics involves a lot of that social communication. And also alternative communication. We treat children that are nonverbal and we give them a method to communicate. So a lot of times that involves a communication device, whether it's low tech, high tech. That's something that we also work with. The two main areas we receive referrals for are articulation and language, but we also treat cognition disorders, literacy disorders, swallowing disorders, fluency or stuttering. So we do receive referrals for those areas, and we have given a handout that lists each area specifically and what that means as it relates to our profession. And the only other area is voice and resonance. We don't see that a lot with pediatrics. It's typically seen with adults, but you know, if a child is hypernasal or hyponasal, we may look at their adenoids or their tonsils, and that's kind of the only thing we see with pediatrics. Primary care practitioners are responsible for looking at the whole child at their well checkups, and oftentimes specific details are overlooked when they are looking at the whole child. Some of those areas are specifics on what the child is saying at a certain age versus are they saying a few words? We want to know what words are they using? Are they making phrases? Are they using sentences? Are they age appropriate for their communication? We want to know what type of diet they have versus are they on the growth curve, but are they eating a variety of fruits and vegetables and meats? You know, it's our job to make sure that they're meeting their feeding and swallowing milestones in addition to just being on the growth curve. We also want to make sure that they're using age-appropriate sounds. That typically can lead into difficulty with writing and spelling if they're sounding it out incorrectly. There's a lot of different milestones that are involved with this, and it's not expected for a physician's assistant to know every milestone at every age in every area. Tri-County Therapy has provided some reference handouts for physician's assistants that list out specific areas and milestones for each age that can be a good reference point. We've also given a questionnaire of just rephrasing questions to parents. So instead of asking close-ended, does your child do this? Yes or no? We're asking them, how does your child communicate? How do they write their name? Can you understand them? How much can you understand them? It's the way that you phrase the questions that's how you're going to get the best information from the parent. The physician's assistant does not always have enough time to go through all of these with a child. Oftentimes children don't talk at the appointment. You don't get to see them skipping and running and walking or writing or drawing a person. You don't know as a physician's assistant what that child can do when the physician's assistant is doing their general health exam. So being able to ask the questions to the parent for open-ended answers, that's the best way to really look at the whole child without missing something. As a physician's assistant, you are the one sending the referral for therapy. There are many referral options. We recommend sending it directly to a therapy company to look at specific developmental milestones and are they meeting them, and having that standard score. There's other options such as an early intervention program or the public schools. Pediatricians and physician's assistants can refer to those sources. However, they're generally looking at their overall development and a child may not qualify. Whereas if they came to therapy first, then we can refer the child to the early intervention program or to the schools, and they take a second look at our information because it's already standardized. For example, my son has autism. He's higher functioning, and when we went to our early intervention program here, he did not get in. Even though we knew that he had some delays with social skills, he withdrew, he didn't respond to his name. One-on-one, he did fine in the testing, but it was our private evaluation for speech therapy that covered all areas of assessments and pragmatics and language that provided the standard scores that were necessary for him to actually get into the program. Otherwise, they would not allow him in if they didn't have those scores. So it's really important to try and start with the therapy and then let them refer, versus that child may get missed if the school says, no, he doesn't qualify. That parent may say, okay, they're fine, but they might not be. As a physician's assistant, you have the choice in who the provider is that you're referring to for therapy. A lot of practices have a referral coordinator, so the physician's assistant may just write a referral to speech therapy, but they don't know who's going to be taking over that quality of care. So if you have a child that, for example, has a feeding disorder, you want to make sure you're referring them to a specific company that you know does quality feeding therapy. So you may put to evaluate and treat for feeding therapy, send it to Tri-County Therapy. And then that lets your referral coordinator know that's where you want that child to go.